500,000 people, including a significant number of children, were wrongfully kicked off of Medicaid because of state system errors, the Centers for Medicare and Medicaid Services said on Thursday. So Politico reported that 29 states in Washington, D.C. were erroneously reviewing eligibility for Medicaid at the family level instead of on an individual basis, the agency said. That means thousands of people, including children, were deemed ineligible for the low-income insurance program when they should have been automatically re-enrolled. Now, CMS alerted states to the problem late last month and ordered them to immediately reinstate coverage for anyone who lost their insurance and paused disenrollments for anyone else who might be affected while they fix the underlying issue or risk losing federal funding. Of course, that doesn't negate the fact that some of these individuals might not have been able to go to their doctor during that time period. You can't undo the damage that has been done in that regard, but at least they're trying to rectify it in some ways now. Politico says, as a result of the glitch, families have been flagged as ineligible for Medicaid coverage, even if a kid or other household member should still be individually eligible. Adults in most states that have expanded Medicaid qualify for the program if they make up to 138% of the federal poverty level, while kids can still be eligible at up to 200 or 300%, depending on where they live. The system errors identified by CMS led to children in at least 18 states and Washington, D.C. losing coverage, while adult household members with different eligibility statuses lost coverage in another 22 states. Some had both issues, and 23 states and territories had neither. So now, of the states that have been able to estimate the number of affected individuals, Nevada and Pennsylvania reported the biggest coverage losses, with upwards of 100,000 people affected in each state. Nevada health officials on Friday announced they reinstated coverage for about 114,000 people who lost coverage because of the program, while Pennsylvania, which is still determining a final number of people affected, is working on next steps for reinstatement and has implemented a manual change to process cases at the individual level. And Brett, the only thing I can think of through this story is that something like this would never happen if we had universal health care. You wouldn't have to go through all of these administrative hurdles. You wouldn't have these issues because everyone would be enrolled. You wouldn't have to, first of all, pay all those administrative costs, but you wouldn't have these types of system errors. You wouldn't have to constantly check eligibility. Everyone would get it. That would solve these problems, like just point blank, eliminated the chances of this happening again.
Yeah, this is the goal of this seemed to be to kill children. So this is the people who are most against Medicaid expansion are Republicans, and in this respect, Republicans are for abortions after birth. It sounds like, just don't provide the medical care to kids and let them die. So many little pockets of horrible here. One, that they would do it on the family level. They just made that up. They just made up that that's how you do it, and then they started kicking people off based on that. The administrative costs skyrocket of then having to get them back on the pay on the rolls, and in the meantime, people don't have healthcare coverage. So either they discover during an emergency that it's going to bankrupt them, or they avoid coverage. They avoid going to the doctor, which makes things worse. And I hate to break it to you, more expensive in America when people either have to use the emergency room or they basically have to use the emergency room when the thing that would have been solved with preventative care due to having coverage escalates into something that is now requiring emergent care.
And speaking of like the possibility of expanding Medicaid, and Republicans maybe having to potentially make the argument as to why children shouldn't get health care. I'd like to see them try to defend that point. But in the Senate, a new bill was introduced that is seeking to extend Medicaid coverage to all children by automatically enrolling them in the federal health insurance program, which is something we should already be doing and are not, but something we should be doing. Some more on that from Newsweek. Announcing the draft measure on Friday, Bob Casey, the senior Democratic senator for Pennsylvania, said in a statement, "As Americans, it is our solemn obligation to ensure every child has the support they need to reach their full potential. Too many of our kids are struggling to stay healthy because their families can't afford the care that they need." Under the proposed bill, children would be automatically signed up at birth and would remain eligible for health insurance until they turn 18. though parents would have the ability to opt out if they already have coverage for their family through other means. At present, minors are only eligible for Medicaid and their family's income is 138% of the federal poverty level in many places, which in the 48 contiguous states is $34,307 for a family of 3. Families earning more can receive lower cost coverage for their children, but there are many who still struggle to afford that coverage. And I was thinking about pointing out how many kids are not covered by health insurance, but I think that doesn't paint a whole picture of the reality of what this is, because even kids who are covered by private insurance, the families might not be able to afford the co-pays, or they might not be able, to still afford to take their kids to the doctor. Even if they are covered, there are still so many costs associated with it, so many hurdles they have to overcome to be able to provide their child adequate health care. So even plenty of people who are currently covered by private insurance might opt to have their kids covered by Medicare or Medicaid, instead, because it might cover more than their private insurance.
Yeah, and there's so many states that are just like, no. The states that have the lowest threshold, typically the poorest states, are the ones who are like somehow run by Republicans and are like, no, we don't want it. We don't want money given to us to keep our own residents alive and healthy. They don't want it. But the thing is if you break this all apart and you ask the questions individually to people, and that's something that we've been doing in when Michael Schur and David Schuster go to Trump rallies, and they even ask Trump supporters, yo, should there be Medicaid? There's people who are going to Trump rallies to say, please turn Medicaid back on for me. And so this is one of those things, if you ask someone, obviously people are gonna say, yeah, we should give poor children health care. It's ridiculous, but this weird backwards logic from some Republicans that they contort themselves into because they just love being a fundamentalist is like, yeah, no, we need fewer incentives for people to have kids if they can't afford it. And this is one, the certain death of their child.
And that is the pro-life position, apparently. Love that.
For more political news, breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.